Well, I'm happy to introduce all of you to our guest on this episode. I have with me Kristi Guillory Reid. Kristi, how are you doing?
I'm doing great today. Thank you for having me, Dr. Huntley. I'm so happy to be here.
I'm really happy to have you here and to have this conversation. We had a brief chat a little while back, and I thought you'd be a great guest to have on this episode or on the podcast in a future episode. So I had made a mental note back then, and it took us a little while to get our calendars synced up, but I'm really happy that you're here. Let's start with you just telling everyone a little bit about who you are and what you do.
Great. I am president and CEO of my own consulting firm, Kristi Guillory Reid Enterprises. By way of profession, I'm an attorney, consultant in a variety of areas. I provide consulting in health policy, well, public policy, but my main specialty is health. But I've worked extensively in other areas as well, strategic planning, as well as helping organizations prioritize diversity, equity, and inclusion.
Love that. So I think that I think from the legal angle coming into, with the overlap of policy and health and your interests, this is an absolute great fit for public health in this conversation. And let's just dive in because my brain is thinking and ticking about all the things that we've talked about. Just a little bit that I've gotten to know you. I like to roll back a little bit. I love sharing the journey of, how you got to where you are now. So one of my favorite questions to ask on the podcast is, when did you first learn about public health?
And that's a great question because, many people think lawyer or how did all this come to be? I didn't necessarily learn about the terminology, public health until later. When I was in, because I also have a graduate degree in public policy, I thought I wanted to go into education policy at first. So healthcare wasn't really on my radar, but I was also learning just about policy overall and what's involved in the analysis and study of public policy. It wasn't until I got my first job out of graduate school, I was selected to be a presidential management, intern. Now they call it fellow. So the program has changed. And I was hired at the Department of Health and Human Services. So I was like, well, this is healthcare, So I was like, well, I've been placed here, so I'm going to, do all I can to learn about healthcare from the federal government standpoint. How is policy made? How is a federal budget put together? And all of these various aspects. And I really liked what I was learning. It was really interesting to me, even though at that point, I will say, I was learning more about the human service side, but still it was at the Department of Health and Human Services. But to kind of fast forward, it really wasn't until after law school and subsequent jobs where I was working at trade associations that really dealt more with public health issues. And I was more familiar with population health and all the terminology and all discussions about public health when I was worked at the American Cancer Society and also worked at the Alzheimer's Association. So it was much later that I was in kind of more public health facing organizations that I learned about it, because it wasn't something I said initially, oh, this is what I want to do in this realm. I knew I wanted to be in the policy world, but later finding myself more in public health conversations and organizations that made decisions based on public health data.
I think that's interesting to hear because I'm used to, of course, when I interview folks that are like public health degree, this is their track, I ask that question, and myself included, we kind of found our way here. So it's really interesting to hear how you describe it because I didn't even know that public health was the thing when I was pursuing health career. I mean, I was pre-med and I thought that was the direction. And I kind of discovered public health along the way. So I think it's interesting to even hear you describe how, this was on your radar, but how the path led you here. I'm
Mhm.
curious, as you moved closer into public health, does it feel like a fit? For me, it felt like kind of what I was looking for all along. I just didn't quite know that there was a name for it, but did it feel like a fit for you?
It did. It felt like a fit for me, there are a number of things in order for something to feel like a fit. Has to be alignment with my skills. And I felt definitely I was prepared with the policy degree, the analytical rigor that I had gone through, and also from the legal standpoint, because I was working in organizations where they're public health organizations, but my role sometimes was to look at regulations. So I was looking at regulations and commenting on proposed regulations, writing testimony, all of those things. But it also has to be a fit to me as a person, individually, but issues that resonate. And working at some of these organizations, of course, not everything in every job you love, but there were topics, particularly those public health issues that affect people of communities of color, that I found that resonated with me, and I understood either from a personal or a professional standpoint. So yes, then I began to think, because even now it's like, oh, I am a public health advocate. Okay, I take this mantle and I'll run with it. So
Yes.
yeah.
Yes, I love that too. I love that. We, as for our consulting firm, we focus on supporting BIPOC organizations, and we are often invited to work with tribal organizations. And it is, like you said, if I like the way you describe that fit, because it's very aligned. It's like, yes, this is just that we talk about having the impact, but it is that passion driven, that impactful work. Like you feel like you've made a difference at the end
Right.
of the day, right?
You feel that the work that you're doing at the end of the day is better than when you started.
Yes, that's great. Yeah, I like that. So, another question for you is, considering, your journey to this point and kind of the work that you do, and I know you have some niche areas, is there a particular population or condition or, public health problem that you're most passionate about now?
I don't know if there's one. I mean, I think when I look back some of the organizations that I referenced, and just again thinking about health conditions that have affected those close to me and just professional experience, I would probably, I know you asked for one, I'm going to probably say two, but I definitely think, oh, actually three. So I'm probably really going to go over what you asked for. But brain health. I definitely think issues pertaining to brain health right now, and I'm glad that this is becoming part of the conversation more as people are looking at what is causing issues pertaining to dementia and Alzheimer's, and ways that we could potentially help our brain health, and really have this is we all want longevity, we want that for our brains as well. And I also think cancer, looking at the etiology of that and how it definitely affects populations of color, but also from that aspect, access to proper cancer screenings, and there are many other factors that affect access. Because I always look at the whole picture, all of the social determinants. Because yes, as I said, I've worked on other policy issues, but many of them there's an intersection with health. If you don't have access to transportation, that's going to affect you being able to see your doctor. You live in a food desert, access proper nutrition. So all of these things, kind of, I think I always tell people, and always use my little this little gesture, like it's like spokes in a wheel. Everything kind of fits in here. Here's the healthy person that we want in the center. But brain health, cancer, and I'm just going to say a third, we are now also, I think, opening up the conversation about women's health and the need for increased funding for women's health research. And also for women of a variety of ages, they're talking about menopause. They're talking about the lifespan. I think it's so important that there is increased attention to it is not always a disease, but just what people go through. Hormones change, things change. What happens in a woman's life? So I'm loving all of the attention being paid to additional funding for, like I said, women's health research, and hopefully that translates into, again, better services and better health outcomes.
Yeah. You definitely, I'm making a side note because you just hit on something, not even knowing it. That's special interest for me. So we're gonna have to follow up separate conversation. I won't get on a tangent right now. But
Okay,
it's
I
under
look
this
forward to
women's
it.
health umbrella and this passion for policy and so forth. But yes, I'm loving to hear all of this. So let's talk a little bit more about your consulting. Tell
Great.
me more about, what who you serve and the type of services and how you help.
I always say I am, say, what is your like, ideal customer, ideal client? I do think for me, while it may sound narrow, I think I'm open to a variety of clients, but For me, I would sum it up like this: someone, a client or organization, because it could be one individual or an organization that is equity focused, because that is very important for me, helping organizations look at DI, but I think my niche is from a policy lens, understanding how this affects public policy. But as I said, equity focused, policy minded, because at the end of the day, I'd love to help organizations develop their advocacy and policy goals and how they can take those goals and translate that into increased engagement for their organization. Clients that are looking to make a difference, and again, there's that alignment between issues that I'm interested in and feel that I can help a client make a difference and their passion as well. Clients that truly want to pay it forward and want to put their money where their mouth is. That would be my dream client. And also clients that don't mind having, going back to DEI, those hard conversations,
Yeah.
because sometimes if an organization is thinking about having a training or a discussion, these are topics that maybe have not been delved into before.
Hmm.
And it requires people to look inward, to examine their own biases. And I tell people the word, there shouldn't be embarrassed or consider it an affront to say I'm a bias. We all have a bias. I love the
Hmm.
color red. I'm biased, maybe over blue. But I mean, we all have a bias. So,
Right.
but clients that aren't afraid to have these types of conversations. But in terms of the types of organizations I've assisted in the past, patient advocacy organizations, national public policy organizations, help organizations, additionally with strategic planning. So the type of organization, I'm very open to serving a wide variety. A lot of them have been in the healthcare realm, but like I said, those that are kind of really, really willing to, see where the rubber hits the road.
Yeah, I like that so much. And I completely get it because I feel the same way. And I think it's important. It's a really distinct like differentiator because those organizations that really do have that genuine, sincere, like, they may say, you know, we're a mess, but we need your help. Or they may say, we don't even have a policy. We know we need to do something, but
Right.
we need you to help us.
And
Those are the ones that, you feel like you pour all into and it's like all good ground.
and they're willing to trust you, and they're
Yeah.
willing to trust your expertise. Like you said, some people don't know what they want.
Right.
So part of it is to help them find it, but also help my guidance, but help them to kind of see their path themselves. Because after the engagement is over, they're still left to do the work.
Right.
So right, it's some of it's hand holding, but some of it's at some point kind of like a parent, like releasing that child into the world. Like,
Right.
okay, now you can do it. You can do it too.
Yeah. Oh, I love that. Oh my goodness. I think that in public health, especially because we keep hearing about how it takes a long time for these big organizations to make the changes that they want to make. And you think about whether it's, on the federal level, the state level, when you've got a large organization, a lot of people and departments, you may have some that are more motivated than others. And then you've got its own internal policies that
Mhm.
they trip over.
Mhm.
But ultimately, when you have a leader that's like, okay, we need to do this, we need to make this change, I hear a lot of conversations among those leaders that are like, we need to make these changes. It's kind of like we have this mess, we don't really know how to do it, we can't do it quickly, and then something happens, and then that leader shifts, and then everything's just kind of left stagnant. But
Yeah.
I think that I can see where your expertise, especially you and your passion for this change, can be so beneficial in a lot of what we think of as our public health leading organizations because they need someone who's got that real drive and passion, who cares and who really is invested. Like this is a high priority because you're in it for the long haul. So
Mhm.
regardless of what changes internally, you can see it through. And I think that that's needed, really needed, and for the kind of change that we need to see in public health.
No, I definitely would echo all of that and agree. And also, as a part of policy, and also another aspect, service that I provide, I think in terms, what's also important with policy are communications. I'm I'm an author. I've written op-eds, but I think you can have the best policy agenda, memos, briefs, all of that. But if they're not written in a strategic manner, no one is going to see them. Or they may see them, but it's not going to produce the change that you want. Things have to be written in a certain way, engaging. And they really
Mhm.
also, we're talking about these topics, have to be written that in a way that anyone can understand them. Someone
Right.
with no background in public health, someone can read, let's say, a one pager and understand very quickly this is the issue. It'll either engage them or not, and understand, okay, this is what they're trying to say. So I think communications is very important and a large part of what organizations need to really pay attention to as well.
Yeah, that's a great add-on point there. Okay, see, I can get all caught in the conversation. I remember, okay, the podcast interview. So let's talk a little bit about, we talked a lot about the type of work and the customer and the client. Would you mind going a little deeper on your products or your services? Do you have certain, how does someone decide, or how do they know they need to work with you? Or like, how do they know how to work with you? Like, what do your services or offers look like?
Sure. In terms of offerings, many times I work with clients on national reports, and for me, I will say the through line with a lot of my work is equity. It may not be, okay, because we want a report on equity, but it's something that I highlight. I worked with an organization last year called Generations United, which I had no idea an organization like that existed, but it makes perfect sense pairing children and seniors together. And they have programs around the country, but because both populations experience benefits. Kids get to learn from older people. Older people, it's less social isolation, but you're teaching another generation. But long story short, this organization did want a report looking at how these organizations, how programs that provide this kind of service are addressing or not addressing equity. They were very specific. We wanted equity. So I produced a national report based on interviews and reviews of their internal data and gave them recommendations. So an organization that may want a report, I also do a lot of stakeholder engagement for clients. Clients want to see, well, what's the pulse? What are people feeling about a certain topic? I'm working on a project right now in the Bay Area focused on youth. It's a community needs assessment. And with that, you're looking at every need. You know, definitely health. We're looking at mental health. There's transportation issues, any topic, safety, but primarily my role is to facilitate focus groups, key informant interviews, design the questions, and really interpret the data for the client. So stakeholder engagement, these reports, strategic planning I've done for organization running, okay, what's the next step? What are our goals in years 3 to 5? So kind of taking the long view,
Mhm.
strategic planning, and then of course there's the policy analysis that I've referenced. We are trying to figure out our policy goals. What can they be, and I work with clients on kind of figuring that out, and also how to amplify their policy agenda.
Nice. Thank you for breaking that down, because I just, I get caught in these conversations, but also try to think about someone listening, thinking, "Oh, she sounds awesome. She could be helpful." I think that helps them to kind of see how
And
they may reach out, or like what to ask for, or like a starting point. So that's very helpful. Thank you. Okay, so I'm having so much fun with this. We're gonna pivot just a little bit,
okay.
because I always like to connect the dots, and this is just, your perspective, your view. And these next two questions I'm going to ask you, it's not about a textbook definition of public health or epidemiology, but I think it's helpful for us to, especially when we think of what these mean to us. I mean, it can mean very different things to each person depending on who you serve, and how you're working and operating. So, but I think it's helpful for our audience who may have just a one track view of or thought, or maybe they're struggling to understand what it really
Mhm.
means. I think it's
Mhm.
helpful when they hear a story like yours, and then they hear you explain, kind of what does public health mean, and epidemiology and so forth. So the first part of this is, how has the understanding of public health helped you better serve and have a greater impact in the communities that you serve?
Well, that is a great question. When I think about my understanding of public health, I think it helps me to anticipate clients' needs. So I think that my background helps me to not, well, sometimes you kind of want to step a little bit ahead, but definitely can walk alongside the client because I can understand a bit of their world, understand their terminology. Sometimes clients get so wrapped up, and I'm in the DC area where we live in a world of acronyms where they just, it's a list of nothing but acronyms and data points and just, decode some of that.
Yeah.
Because I think I've been in that world for long enough. And particularly, again, going back to my passions, understanding social determinants of health, understanding their impact on communities of color, and also aging. That's another interest area of mine. So, really kind of helping, anticipating their needs and really helping them to distill that information for whatever audience or even internally or externally. Because sometimes clients, a lot of people think work is always external. Sometimes you have to almost help clients amplify their voice, whatever department you're working with internally. Like, well, no,
Exactly.
well, this department doesn't know what we're doing. How do we get them to know what we're doing? How can we work with them better? So I
Yes.
think, all of my experience and expertise helps me to understand, just really get a good understanding and kind of think, okay, so what's our next move and be strategic about that.
Yes. Oh, yeah, that's good. I'm so glad you added that in. That's also something that resonates with me in these large organizations, like I'm talking about. Like you said, the departments, sometimes communication before we can even go out to the communities we're serving, we have to communicate within our departments, especially if there's
Exactly.
like these. Public health is known for silos. So we don't want, like, all the epidemiologists are here, all the policy folks are here, all the,
Mm-hmm.
we
Mm-hmm.
don't, we need to really start,
Break
sometimes
it.
it's about breaking those silos and communicating. So I'm really glad you added that in there. So, in that same kind of vein, how has the understanding of epidemiology helped you, serve your clients and communities and have a greater impact?
And that's a great follow because it's they kind of go hand in hand, the understanding of public health and also the understanding of epidemiology. I think that helps me in understanding the importance of evidence-based policy making, because you can write a product that's wonderful, but at the end of the day, it's going to it's evidence.
Yeah.
That's what people want. And some people, depends on you. You have to think about your reader. Some people just numbers people. They're going to flip through it. Where's the data? What's your
Right.
source? So understanding the importance, sometimes you have to highlight certain data points at certain times and how all of that works. And I think also my experience working with, lack of a better term, these disease organizations has broadened and deepened my understanding of epidemiology and also my ability to evaluate different strategies. And also based upon those strategies, what is the appropriate response?
Yeah.
So again, it's helped me, I guess, more in an develop more of an analytic framework. And
Yeah.
but again, I think when I think epidemiology, I'm thinking data, numbers. I'm not exactly a data person, but I know enough to make sense of it.
Yeah.
And I work with people often on projects who may crunch the numbers, but I know enough to make sure that it makes sense and understand what we're talking about. But and based on data, that's when you can develop these really detailed and nuanced policy and strategies, policy and advocacy strategies. And even data can play a role in trainings. When I was at the Alzheimer's Association, conducted a training on various topics on training staff in the basics of Medicaid. Medicaid is full of data and it's state-based data, but understanding, okay, if you were presented with this, if you have to advocate on a state level, what are the data points that you need? So it's all interrelated, but being able to just make sense of it.
Yeah. Oh, that's great. I have a friend who is an epidemiologist, and he's very active in actually policy. And he's always talking about, and I completely agree, but he's always saying that, epidemiology and policy, like, and advocacy, like, it has to be together.
Exactly.
So I love hearing you kind of share your view and perspective on that. So that was really great to hear you put it in your words from your view there. This has been so much fun. I've enjoyed
It's
getting to
fun.
know more about you. And in hearing about your work, and my mind is thinking of, wow, more and more things and other people like the person I just mentioned. I'm going to make sure that I connect you to. And in fact, he's in your area, if I'm not mistaken, but we'll chat about that too. But I have just
Perfect.
one more question for you, and then we can wrap up. But we have a lot of different, a very diverse audience of listeners of the podcast. So we may have students of, from undergrad all the way up to working on their doctorates. We could have early career professionals or senior career professionals and entrepreneurs. I mean, people that are from other industries that are curious about public health tune into these conversations because they
Mhm.
get to, understand more. So just kind of considering that diverse, blend, I like to ask for a tip. So if there's someone who's listening and maybe they're interested in doing something similar to what you're doing, like moving more into policy advocacy, what bit of advice, if you could give them a tip or a little tidbit, what would you share?
I may, and that's a great question. I think sometimes you always wonder, even when I was, you know, early in my career, I would have loved having something like this. Of course,
I know,
podcasts
right?
didn't exist, but I'm like, where was this when I
I
needed it?
know.
But I think I would probably, because I just look at my career and maybe say something that's not say unorthodox, maybe say something a little different. I would probably say, don't box yourself in one area where a lot of times people think, okay, I have to develop this niche. Well, it is partly true. So yes, you do want to be known for a skill set or let's say a niche area because as I said, I'm in the DC area and people, it's very niche. You're the health person. You're the this person. But I think what has been of benefit to me, my niche are those skill sets that I referenced before, the communications, policy analysis, all of that. But I can pivot to different areas of policy. While this is a public health podcast, as I said, let's say if I do need to turn my attention to, I don't know, something very different, like I mentioned this project I'm doing about youth, I've had to learn about early childhood education. The subject may be different, but the skills are transferable. And I think that's what makes people marketable and also just more interesting.
Yeah.
You have all of these varied experiences, but at the core, you've got that skill set. And some people may completely disagree, but this has worked for me, and I love it. As I said, I'm a writer. I mean, I write children's books, but it's writing. So it's all of these different things. And also don't be afraid to try something new.
Yeah. Yeah. Oh my gosh, I love it. Love it. I'm going to take that advice if no one else takes it.
Great, great. I've inspired one.
Yeah. Thank you so much. This has been a treat to have you on
Thank
this
you.
episode. Of course, I will provide all the links to connect with you in the show notes for this episode so our listeners can. I'll tell you in just a moment how to find the show notes page. But just briefly, what is the best way if someone's listening, just curious, like the best way to connect with you? With the user particular platform you hang out on, or where would you like people to go?
Oh, that's a great one. I have a website for my business, but I think most easily how some people have found me, LinkedIn,
Yeah.
and it's my name. I can go ahead and
Yeah.
spell it.
Yeah.
Kristi Kristi Guillory Guillory Reid Reid. My bio, some examples of my work are there, and that actually will lead them to my business website. And people have sent me messages or connected with me. I think LinkedIn is a great way to
Yeah.
find
Oh,
connection.
you mentioned my favorite platform. I love. In fact, that's how we connected on LinkedIn.
Exactly. Oh,
Yeah.
that's good. Exactly. See,
I
it
love,
comes full circle.
yes, I love LinkedIn. And also, I'm going to add to, like I said, we'll have all these links in the show notes. But if you reach out to her on LinkedIn, make sure you add a message and let her know you heard her on this podcast. I think that'd be
That would be great.
great. Well, thank you so much for being my guest. And we're going to be in touch for sure. We're going to stay in touch.
I think that would be great. And thank you so much for having me. I've enjoyed my time chatting with you today.